All right, our next presentation is going to be from Pam Lanhart on reducing harm in families impacted by opioid use. Pam is the founder of Thrive Family Recovery Resources, which is a recovery organization that supports family members impacted by their loved ones' substance use disorders. She's also a certified family recovery coach, peer recovery specialist, and a family comprehensive care consultant. Along with all of those things, she's also a really great longtime advocate, not just in Minnesota, but across the nation. So, here's Pam.
Thank you. Okay, so first of all, I have to tell you I'm so excited to be here because my mom went to school at the one-room schoolhouse in Reading, Minnesota. So yeah, all my family is from Worthington. You might have heard names like Wasmond or Hinch or Russell or Salberg. Those are all my family. I got to have dinner last night with some of my cousins that live here still. So I drove in and I took a little drive down memory lane. My grandma lived on West Okabena Street, and we spent almost every summer down here with Grandma Hilda. So anyway, just deep roots in this community. Probably some of you are probably related to me. So thank you. I want to thank Steve Rummler Hope Network for inviting me to speak today. And thank you guys all for being here. This is a really great turnout. And it just shows the care and concern that you have for your communities. So before I even start my presentation, I want to ask those of you who are here, how many of you are professionals that work with people that have substance use disorder directly? How many of you guys are? Most of you. All right. How many of you are a family member of someone that has been affected by substance use? All right. And how many of you have known someone who has lost their life to substance use? So many of you. And first of all, I just want to say how deeply sorry I am for that loss. We lost our son in October of 2021. Now, I just want to caveat it that I started this work long before that, but I know the deep pain that comes with that. And I always, when I talk about working with families, I always sort of qualify it and say, in spite of everyone's best efforts, sometimes the end result is death. But what we do in the work we do is to try to mitigate harm in the family system. So just a little bit about us. So Thrive Family Recovery Resources was formed in 2016. Last year, we became grant funded by the Department of Human Services so that we can provide services to families for free. We offer one-on-one guidance and peer coaching to families. So we have staff that are certified peer recovery specialists, but that are also trained to work specifically with family members. We have educational workshops that we do that are based on evidence-based practices. So I'm going to explain a little bit about what that is and why that's important as we move through the presentation. We connect family members to resources. And then we also really work to provide support for those families. So we have some virtual support groups that meet every week that are informed by evidence-based practices. And again, I'll share a little bit more about what that means later. So first of all, just to make this a little more participatory, those of you who work in the field, you probably run into families all the time, or you have been a family member impacted. What do families feel? What's kind of that first initial feelings that they have when they discover that their loved one is using substances? What are some of those things? Anybody? Just throw it out. Popcorn. Fear? Sad, right? Anger? Denial. Okay. Guilt. Yeah. These are just so many of the emotions that we know that families experience. They feel helpless. They feel alone. They feel afraid. They're filled with grief. They feel very unsupported. And they're, sometimes they feel like they don't have anything that they can do, right? They feel done. Maybe they've tried a lot of different things, or maybe they just don't know what to try. What do you think families think when they discover that their loved one is using substances? What are some of the thoughts that they might have?
Scared.
Scared.
There's nothing I can do.
There's nothing I can do. That's a big one, right?
Guilt.
Guilt, okay.
Sadness.
Embarrassment, sadness. They might think things like, why are they doing this to me? Why do they keep doing this when they know that it harms them? How could they do this to their family, to their child, to their loved one? They might think this is crazy. They might think that they are just an addict, a manipulator, a liar. So there's a lot of thoughts that go through a loved one's thinking when they are impacted by substance use. Like sometimes they don't even know what to think. And sometimes with opiate use disorder, it catches them so by surprise that they're actually filled with their own guilt and shame, right? Like, how did I miss this? How could I let this happen? He should know better. Why don't they just quit? Why don't they? That's a really big one. And we see this a lot in the dynamic of a family member who maybe is in recovery from something, and then they have a loved one that is impacted and they quit. So of course they expect that their person should be able to quit just as easily. What do you think families hear from professionals, society, their friends? What are some of those messages that they get?
Kick them out.
Kick them out, right? What else?
It's your fault.
It's your fault. Yeah, why didn't you parent differently? Right? Why didn't you parent differently?
It's not your fault.
Oh, it's not your fault. Okay, that's actually a good one, right?
Enabling.
That they're enablers, right? That's one. Mm-hmm. These are some of the things that I heard when my son was struggling early on. If you just parented differently, you wouldn't have this problem. If you help your loved one, you're helping them die. You're an enabler, you're a codependent, you are too involved in their life or recovery. You have to just let go. There's nothing you can do, right? Just go to a meeting. That was a big one. Just go to a meeting. And that was the kind of help that was offered 10 years ago, 15 years ago. And I remember, and part of the reason why I created this organization was that I saw this movement of peer support and peer recovery and multiple pathways to recovery for the individual suffering from substance use. But for the family member, there was only one type of help. And it was just go to a meeting, right? And so I went to my first meeting, and my son was 15, and there were words like addict, alcoholic, codependent, enabler, and I did not find that they were helpful for me. So I started searching out other ways to help myself, other ways to help family. And some of the things we're going to talk about today are actually researched and proven to be really effective, highly effective in helping families. But why do we even want to help families in the first place? So that's a big one. As you know, addiction impacts 23 million people a year directly. So there's 23 million people that have substance use disorder. Now, there's a wide varying of statistics on this, but even if you just think logically that 2 to 3 people are peripherally affected by someone's substance use, right? So you usually got a mom or a dad or maybe both, siblings, maybe there's kids that are impacted, which means that in the United States, there's a minimum probably of 50 million people that are impacted by someone's substance use disorder. That could be as high as 100 million. Most people estimate that for every one person impacted, there's 4 people peripherally affected in that immediate family. And yet, by and large, families have been completely unsupported. The data looks at what's out there for support for families, and there's about 350,000 people a week that engage in a support group. And that leaves a lot of people that aren't getting any help. And why is that? It's shame, it's stigma, it might be a lack of resources. So we're aiming to change that. What we do know is that in the recovery ecosystem, one person can start to get help and activate their own recovery, and it changed the entire family ecosystem. And we really know that families are the first responders. Families are the ones that recognize almost immediately when something is wrong in their family. And yet they're guided to detach, to disconnect. We're going to talk about some of the stigma and some of those misguided ways of interacting with their loved one. So why do families matter? And why am I even talking about this today? And again, we know that when they are equipped and when they are supported, they can become the most valuable resource in the recovery process. Now, they're the ones that are going to respond when someone in their home overdoses. They're the ones that are going to be those first responders if someone comes to them and says they need help. And they matter for a number of different reasons. So families are a valuable resource in the management of any disease. So what's interesting about substance use disorder is if you look at other diseases. So I had a friend of mine, and her daughter just found out that she had diabetes, right? So the daughter is an adult, but is in the hospital, and they asked the family to come, and they got them all together, and they did a family meeting, and they discussed, what changes would need to be made in this person's life, because they know that it affects everyone in the family. So they gave them education, they gave them a lot of information about the disease of diabetes and what to expect when she comes home, and they were brought into that recovery process. And there's a reason why they do that, because they know that families are significant when it comes to the management of illnesses, right? If your husband has a heart attack and he comes home, they're going to talk to you about, lifestyle and how that home life might need to change in order to support that person. Yet with the disease of addiction, with substance use disorder, families are by and large held at bay and actually labeled as the enemy. And in fact, in Minnesota, 98% of treatment admits in Minnesota are Medicaid eligible, but family work is not reimbursable. So that gives you a really clear picture of how that's valued when somebody activates treatment. Families provide an more accurate picture of what's going on in the home and of their disease. So mom knows, usually moms know, usually dads know what's going on in the home. Families are the primary source of health-related beliefs. So we see this often where, there might be a history of eating disorders or a history of obesity or a history of other behaviors in the family. Maybe things that aren't necessarily fall under the disease model. Maybe, 5 generations of people that smoke in the family, or 4 generations of other diseases that are more attitudinal than health related. So we know that we pass down some genetics. That's a really small portion of it, which I'll share in a minute. But we also pass down a lot of ideology and a lot of behavior patterns. And we see this in almost every family. Families care the most. They have the most to gain, right? So they don't want to lose their loved one. They want to make sure that their loved one is safe and that their loved one stays alive. And they actually have the most regular contact. So I'm going to talk about that in just a minute. But this is the social determinants of health. Some of you have seen this chart, but if you look at this chart, what's really telling about it is only 10% of the social determinants of health are clinical, and all of the rest are societal, social, and familial. So we know that even though there is, it is a disease, there's no actual gene for substance use disorder, right? So they talk about that it's inherited or that it's genetic, and it's patterned is what it is. And there's very little evidence that really ties a genetic makeup to substance use disorder. But if you talk to somebody, you'll hear them say, oh yeah, it runs in the family. Because so much of that are behaviors and ideas that are passed from one generation to another. I talk to a lot of people, and different cultures and ethnicities. And, one of the things that I hear often is, my family always had parties. They drank all the time. We would clean up after them. And I drank my first drink at 8 years old, right? Now, obviously, with opioid use disorder, there's other factors too, which are things like medications that might be common for a family to use. And those medications maybe aren't kept safe, they're not locked up, things like that. They have the most regular connection. Now, this is data that was research that was done by Judith Landau. She's a doctor. She runs an organization called the Arise Network. And the data supported that 80% of people with substance use disorder, actually this was specifically opiate use disorder, live with their family. 80%. 64% of people with opiate use disorder have daily contact with their family members. So as opposed to 9% of kids that don't. So I have, adult kids, and I'm lucky if I hear from them once a week, right? They're busy, they have their lives. But when substance use is present, 64% of them are contacting their family every single day, which means that they really have a lot of influence in their loved one's life. And this is another statistic that shows that when families are involved in the treatment and recovery process, over the end of a year, 71% are still engaged in some sort of treatment and recovery. So when your loved one is presenting with substance use disorder and maybe they come to the point where they need some help, who do they go to? They go to their family, right? They ask mom, they ask dad, or maybe the family member, the mom or the dad, are the first ones to recognize that there's a problem. So that just gives you some data on the importance of families and why, as professionals, you want to do as much as you can to try to engage a family, and also why we think it's really important to help families get healthy. And I think that's the work that we get to do every single day. We talked about language, and language is so important, and I am not going to drive this point too deep because I think they did a really good job of talking about the stigma of language. But when it comes to families, it's so interesting because they might look at this and go, yeah, I understand stigma. But then when they call me, they're like, my daughter's an addict or my son is an addict. And I like to tell stories, and I have a little story that I want to share with you about this that might exemplify it in an even deeper way, because I think sometimes we think that we get this, but we don't really get this. The little story that I have is that I'm in a book club, and we read this book, and it was called Beartown. It took place in the Black Forest of Germany, but it's a hockey town. So a really small town. And just think like Virginia, Iron Range hockey is everything. Or in Worthington 10, 15 years ago, it was wrestling, right? My cousin Dave Wasman was a wrestler here in Worthington. So I know wrestling was a big part of your culture down here. And you've got this person in town who's the all-star, and a family moves in, and they're at a party together, and the star hockey player rapes the new girl in town. So there's this division in the community, and it becomes us versus them. So this is a fiction work, but I think it really exemplifies the idea of stigma. Hate can be a deeply stimulating emotion. The world becomes much easier to understand and much less terrifying if you divide everything and everyone into friends and enemies, we and they, good and evil. The easiest way to unite a group isn't through love, because love is hard. It makes demands. Hate is simple. So the first thing that happens in a conflict is that we choose a side, because that's easier than trying to hold two thoughts in our head at the same time. The second thing that happens is that we seek out facts that confirm what we want to believe. Confirmation bias, right? Creating the narrative. Comforting facts, ones that permit life to go on as normal. The third is that we dehumanize our enemy. There are many ways of doing this, but none that is easier than taking away their name. And don't we do this in substance use? We take away their name. We call them addicts, liars, manipulators, junkies, and we hear this from family members. These are the labels that they're putting on their loved one. It's a sin, it's a demon. And no wonder they don't get help, because that's what's being put on them. Just a little summary of what they said earlier. Instead of addict or alcoholic, we encourage families to talk about it as a disorder. Those are some of the ones that they already talked about. But we also find that with family members, there's also words that create stigma. So as you're working with family members, I have mothers that call me crying saying, I'm such an enabler and there's so much shame, or I'm codependent. There's sort of this assumption that if a loved one struggles with substance use disorder, you're automatically codependent. But if I'm helping my loved one that has cancer, I'm not. If I'm helping a loved one that has heart disease or diabetes, I'm actually engaged in that and that's celebrated. But if I'm helping someone with substance use disorder, if I keep Narcan in my home, if I want to keep them alive, if I drive them to the methadone clinic, I'm told that I'm an enabler and you need to, detach from that and not help them. They have to figure it out for themselves. And those messages include things like, you just have to do tough love or disconnect. So we're going to go through a few of those common myths and sort of break those down and shatter them a little bit. And these are the things that we work with when we work with a family. So if you have a family member, and what we do is we can offload providers and professionals and community organizations and help them to have these conversations with family members when you guys are too busy or too overwhelmed or don't have time to do this. This is our specialty. So the first one is that substance use is a choice. I know that most of you probably agree with this, but one of the things that we help families understand is this concept of behaviors make sense. So substance use as a disorder, we recognize that it's rewarded and reinforced. So when I feel pain, I can take this pill and I don't feel pain anymore. When I feel sad, I can have a drink and all of a sudden I'm happy. When I feel like I don't fit in, I can, smoke a joint with my friends and I'm the life of the party. And so we try to remind family members and even professionals that substance use isn't a choice, but it's actually a response to pain. When I am in pain in any way, and it doesn't have to be complex trauma, it's just simple pain points, I can do this, I can take this, and then I feel this way, and it's a reward system, right? Now I take this pill, I feel great, that was reinforced, it releases dopamine in my brain, and I feel better. And so we really help families and educate them on the neuroscience of addiction. So these neural pathways are created, it's a reward and response system, that they're not bad people trying to become morally better. There actually are ill people trying to get well, and that there's a neuroscience behind it. The second myth is that family members should practice tough love and detachment. Now, of course, we talk about boundaries, and we're going to talk about that in a little bit, but we know that, again, society puts that on them, that there's sort of this one-way message with family members, which is that they have to do tough love, they have to, disconnect, that they should cut off their loved one. I mean, I'm in some of these, support group, Facebook groups, and you hear it all the time. Oh, I had to do tough love. Like, there's a lot more tough in that than there is love. And what we find is that, families will often say that they love their loved one in their way of being. They're not necessarily very loving. And so we kind of help move them away from some of those messages. Again, it's that stigma. It's that conditioned thinking that society puts on family members, that this is the only way that it works. This is the only way that they can do it. And we have data that really supports that there is a more compassionate, empathetic way to walk through this. So of course they want to disconnect because they feel like it's their fault. They might not really understand the disease or what's happening. Like they still think it's a choice. And this is really prevalent in other cultures. So I know there's some large ethnic populations in Worthington. I see this, I work in partnership with the Somali community quite a bit. And we see this, like someone dies from an overdose, they bury them within 24 hours and they put that they died of a heart attack on the death certificate because they don't want anyone to know that they have died from an overdose. If a person in the family presents with substance use disorder, the almost immediate response is to remove them from the home, to kick them out, because there's still so much shame in the disease. So they don't understand what's going on. Or maybe religiously, they don't want to, you know. And we see this in many different communities, many different religions, not just Somali or Muslim, not just Christian, but kind of across the board. Maybe they have unrealistic expectations. They won't go to work. I'm telling them that they need to do these certain things and they're not showing up. And so I'm just going to give up on them. They might have their own personal trauma or mental illness. So if you come in contact with families, I just got a call the other day from a mom, and she was just trauma after trauma after trauma after trauma in her life. And then seeing her son overdose over and over and over again. And so my first response was, like, are you in therapy? How are you getting help for? And then she texted me the next day and said, I just made an appointment with my therapist. So I was really happy about that. Again, they're told their enabler is codependent. They've been told by professionals that the only way to do this is to disconnect or detach. And that can cause harm. And this whole thing that we're doing is to reduce harm in the family. And then they haven't been guided with tools and skills. And maybe there's a lot of professionals and therapists who aren't educated on substance use disorder. They're not educated on addiction. They don't even know that some of these other ways to do this exist. So we really help families take a pause and decide how they want to show up and respond with intention rather than reacting. And it's normal to react. When you're in pain, you've got the fight or flight response. So it's really normal. I feel pain, and the way I mitigate that pain is either to control or to shut down. Control would be the fight, shut down would be the flight. So we're going to equip them. And of course, we always talk about boundaries as a way to stay connected. Now, boundaries are, there's a little saying when we work with families with boundaries that say what you mean, but don't say it mean, right? So we want them to define realistic boundaries. We give them language to help them with the boundaries. We have a process so that they can do this really compassionately, which is, I see you trying. I see your efforts. I know you love us. I know you're not doing this intentionally. And when this happens, I feel this way, and this is what I need. And it's a really lovely way to set boundaries. I'm not going to go into that too much. That people only change through negative consequences. Now, this is a big one, right? That you have to sort of, again, impose these consequences on your loved one, and that they have to, hit rock bottom in order to get help. But we know that for 110,000 people last year, rock bottom was death. So what we help families understand is the idea of reinforcing positive behaviors. So again, going back to behaviors makes sense. When I have a behavior and it feels good, then I do it again. I repeat that behavior. And so we really help families to work through some exercises on what are some things that we can reinforce? What are some things that we can do? What are the things that we can look at in their lives where there is some positive and build in positive reinforcement? And what's interesting about that is there's actual science that and we're going to talk about contingency management in a little bit, that shows that when I reinforce the positive, it changes both my brain and their brain. So as a family member, if we can encourage the families, what are some things that they're doing right? What are some things that you can do for yourself that are more positive? It actually creates new neural pathways because we're competing with, as a family member, I'm competing with that drug basically. My relationship with them is competing with the relationship that they have with the substance. So we help them learn to reward and reinforce positive behaviors. So we go through exercises with the families to help them understand intrinsic motivation for the substance user. And some of this might be new for some of you guys as well, but contingency management is a really up and coming way of helping with people changing. And so there's actually apps that reward people, wellness apps. Some of you guys might even use some of these wellness apps, right? Where every time you do a behavior, it pings you, and it pings you. And we know that when we get pinged, we repeat the behavior. So what we want to do is step out of that punitive mindset and get into the mindset of how do I ping? How do I reinforce any positive behaviors that I see my person doing? And then, of course, we do want to allow for those natural consequences. But what we try to help families understand is we can get out of the punitive mindset. There's enough shame, there's enough blame, there's enough, difficult stuff going on out there for that loved one. And if we just step out of the way, chances are that they're going to experience some consequences, which then will help engage them into getting help. And again, we talked about this. A person has to be ready or hit rock bottom. And this is one where I hear this all the time. Well, they have to want it. They have to want it. And they do to some degree. But what we can do as professionals, and when you come in contact with families, is help them understand that there's a process of change. How many of you are familiar with the stages of change? Some of you are, okay. So for those of you who didn't raise your hand, go back and Google stages of change. And so we don't talk about denial. We talk about the pre-contemplation stage of change, which is that they aren't really aware yet that they have a problem, or maybe they're aware, but they're just not willing to do it. Well, what happens is when somebody's in that stage of change, and you might experience this yourself, we think that the way to get them out of denial is to confront. And then we just are creating an environment that is shaming for them. And so we can actually help someone with substance use disorder move through this change process. And if they are in the pre-contemplation stage, we're going to work with the family to make sure that they keep that person safe. Right? Safety is always first. That's why we are here partnering with Steve Rummler, because we know that dead people can't recover. And that the very first thing that families can be taught is that we can help them. We don't have to be confrontational, but in the meantime, we need to keep them safe. Change takes time. And ambivalence is normal. We see this a lot where someone will call and they're like, my daughter texted me and she wanted treatment and I found a bed and I got her all set up for detox and then she ghosted me. And that happens because they do want help, but they are also afraid to let go of that good feeling that they get from the substance. And again, that's where all of this harm reduction work comes in, that I need to connect with them. I want to stay in it with them. I don't want to blame them or shame them while they're in that stage of change, that it's possible to want both things. I always kind of laugh and say, I want to be skinny, but I really love the chocolate covered marshmallow Valentine little hearts, right? And so I'm ambivalent, right? I want the hearts, I want the candy, but I also don't want to, I want to stay thin, right? And that's what happens in substance use is we see that ambivalence, and that's that opportunity. And then the interesting thing about harm reduction is that when I engage a person and I connect with them, there's a exponentially greater chance that they're going to get help. So that relationship is so important, right? If there's no relationship with people who are using substances, it drives them to the drug. The drug, they have a relationship with the drug that makes them feel really, really, really good. And so if I'm cutting a person off and I have no relationship with them, you know, I'm not in a position to really help them. And so we're how do we connect? How do we keep them safe? How do we stay safe? That's really what draws that motive. And then walking with them. So I have a friend who called me yesterday. She's a peer support specialist, and she has someone that she's been working with that wants to get help. And we were talking about getting this gal into detox and how this peer support specialist could help her. And I said, you know, worst case scenario, if it's too hard for her to pick up the phone, make a 3-way call, right? Make a 3-way call. Don't be afraid to talk about hard things, helping families to understand that if we're talking about naloxone, we're not condoning drug use. We're helping them stay alive until they can get to the point where they engage in that help. So staying with them, all the while having those boundaries and protecting themselves. And again, allowing for those natural consequences in the process of change. Myth 5, there's nothing you can do. And this is, I just have to look at mine. This is a large part of the work that we do. And what's interesting, I did a talk to 105 Ramsey County social workers a couple weeks ago, and they're like, we didn't know a lot of this. This was really new information. So I hope some of what I'm sharing with you is new information, and you can even apply some of this to the work that you do when you come in contact with family members or with individuals with substance use disorder. But we equip families and we help them collaborate. And we do this in a number of different ways using evidence-based practices. And I'm going to talk a little bit about CRAFT, which stands for Community Reinforcement and Family Training. And CRAFT is the most researched way of helping loved ones help their person. We use motivational interviewing. We call it our communication superpowers. We work on it, helping them to invite change with their own self-awareness. We'll help them activate therapy. There's many different kinds of therapies that do equip family members, DBT, CBT, trauma therapy. We do have evidence-based family recovery meetings, and of course, harm reduction. And then if they do have a return to use. So community reinforcement and family training, for those of you who aren't aware of this, it was developed by Robert Myers back in the 1970s, and it's been researched extensively. A lot of the research they did was with at-risk, unhoused youth that were resistant to change. And CRAFT is a harm reduction intervention. So usually it takes about 6 months of working with an individual to help them engage in the process of treatment or getting help, but it's very effective. It was researched against Al-Anon and against Johnson intervention, and it was 65% effective in engaging a substance user into treatment within the first 6 months. So it's a really revolutionary way to help families. And there's some objectives with CRAFT, to reduce a person's concerns for harmful substances, to engage the person of concern into treatment, to improve relationships in the family, to improve functioning of the family system, meeting someone where they're at and helping the family member to have more peace and feel more empowered in that process. And then we help families using these skills. And I call these the superpowers, but these are those harm reduction skills that we can help families and equip them with. So I'm going to actively listen. I'm going to validate where they're at. Going back to the stages of change, if someone's in, the pre-contemplation stage, the denial stage, rather than saying, well, you are a user, you are an addict, you need to get help, what we do is help the family shift their language into, okay, what I'm hearing you say is that you're not really ready to get help right now. Tell me more about how you can stay safe. So we validate where they're at and we affirm their right to make their own decisions and their own choices. And then we bring in those skills of curiosity, which are, tell me more about that. I'm curious. I'm wondering. And helping families take a step back from telling, and we like to tell, right? And we tell because we're afraid. You need to, you have to, you must, if you would only. And, there's no wonder that the family is fractured because the family member only knows one way. They're in pain, they're struggling, and the way they've been told or conditioned is to confront. Like, you have to get help. You have to get treatment. You need to do this. Oftentimes it's like, you have to get a job. Whereas if we can, and then the person with the substance use disorder detaches from that. They don't want to be around that. Right? So equipping these families with different language and tools and skills, asking open-ended questions. Let's just say they're in the contemplation stage and they're really thinking about getting help, but they're ambivalent. Well, what would help look like for you? So many times the families that you guys probably run across or we run across are like, there's only one way, you have to go to a residential treatment program. Well, we know with opioid use disorder, there's multiple ways to recover. And the very first thing might be to engage in getting on medication. So a family member comes to you and their person is using, and you give them naloxone and you give them fentanyl test strips, and then you can move them to a place where you might suggest that, have you considered encouraging them to get on Suboxone or take a Sublocade shot? Or, even methadone. If that's the only thing that, maybe they've tried Suboxone, they've tried Subutex, they've tried all these different things and they're still struggling. There's nothing, like, there are people I know that have been very successful in the methadone program, and it works way better if they are living in a safe and stable environment and have the help and assistance of their family. It's almost impossible to do that without help, because there is that need to have to go get the methadone every single day. And of course, harm reduction as a family strategy. We talk always about meeting a person where they're at. And this is really important. It's really important. Most of the families that I work with, again, we see this in, I get a lot of people of faith, and they're like, the only treatment that will work is Teen Challenge and Jesus, right? And that does work for some people, right? It does. But it's not the only thing that'll work. And so getting families, regardless of their culture, to kind of step out of their, boxed thinking and ask those questions. What do you think will work for you? If that program doesn't support Suboxone, like, I love Project Turnabout. I love it, but they don't support Suboxone, right? So I'm not going to refer to a treatment center that doesn't support medications for opioid use disorder if the person is using fentanyl. That isn't safe, and it causes death. So I think it's really important. And I love to share stories. So I'm going to share a story about why that is so important and why the role of the family is critical in that. So we had a mom and dad come to one of our support groups, and they hadn't had contact with their son for quite a long time. Well, he ended up in jail in Dakota County, and in Dakota County, he was able to get Suboxone. So he went through the withdrawals, he was on Suboxone, and he started connecting with the family. Now, when the family came to our group, they were told that they had to disconnect, and they were told that they had to do this tough love. So we started helping them engage in a responsible, respectful way with this son who was in Dakota County. After his 30 days in Dakota County on Suboxone, he was extradited to Brown County. They didn't support the Suboxone. He had enough to get him through a little bit of time there, so he was able to bring the prescription in, but they would not re-prescribe. So he did his 2 weeks in Brown County, and he's about ready to get released, with no Suboxone. The script is ready to run out. Now, had he not had the support of his family, there's a high probability he would not have made it. But through the work that we do, through harm reduction, through helping his family connect, they met him at the jail when he got released at 11:30, so he wasn't at, a 400% higher risk for overdose death. They did a virtual appointment with a Suboxone provider, went to Walgreens, got him on Suboxone, and by 3 o'clock in the afternoon, he had a bed at treatment, and they brought him to treatment. And that's where the family system comes in to play. Had mom and dad not been there to help him, he would have released from jail without being on medications, with an opiate use disorder, at risk for overdose and death, no phone, no one to pick him up, no help. He either would have been dead or back on the streets. And he's doing really well in his recovery right now. So engaging those family members in the process, helping them make decisions based on what they want and they need. It's so important. And then obviously, and this is sometimes hard to think for families to think about, fentanyl test strips, or clean syringes, sterile syringes. Well, if I do that, I'm condoning use. I'm helping them use. Well, no, you're preventing disease and death. That's what you're doing. So you all, as you come in contact with people, have the power to help shift some of these paradigms, shift some of these messages. And I have another story about Cindy, who was a gal who had been to a different kind of support group that told her to detach and disconnect from her son, Jared. Jared was a vet, and he ended up out on the streets because they thought that was the way to get him to hit rock bottom, right? So he was using on the streets, using IV, heroin, and fentanyl. And Cindy started engaging in some of our workshops and some of our groups. And ultimately, she just started meeting Jared at a park across from a hotel that he was living in. He wouldn't let her pick him up at the hotel because he didn't want her exposed to that. But they would meet at this park, and they met every week. And she just met him where he's at. No shame, no blame, just connection, just love. And then they would go back. She would go to her house. He went back to the hotel. And they did this for about 2 months. And then Cindy brought Jared's nieces and nephews because that was really important to him. And it was safe enough and supervised where she could do that. And they did that for another month. And then one day at that park, Jared said, "I'm ready for help." And he said that to his mom. And the reason he said that to his mom was because they had a connection. And he knew that she was there to help. So they got him to the methadone clinic. And then they did ketamine treatments. And he said, I just don't think I can do that 12-step thing. So they found a different way to engage him, and it worked. And now he's 3 years in recovery, and he rides bikes all over the country. He has a sober bike group that he's formed, and he's really reaching back and helping others. So what we've learned is that outcomes improve when families are involved. So I always finish my talk with this little story about Jake. And this is my son. I thought I took this picture out for today, but I didn't. So I'm just going to finish up with this story. And like I said, we can't stop death always. But what we can do is we can help families live. And I always talk about, take one little story I want to share about him is that the night that he died, he saved his friend's life with naloxone. And that's one of his legacies, is that his friend is in recovery now. And had he not had naloxone, that friend would have died. So I have that comfort, but I always talk about what we gained. And, we were that family, right? We were dysregulated. We were confrontational. We were trying to save his life. And through some of these actionable solutions and meeting him where he was at and harm reduction, we got some really amazing years with him. And I always, I call it Lazarus time. And I just share this as a story, not to get religious on anybody, but there's a story in the Bible about this friend of Jesus named Lazarus. And Lazarus died. He died. And then his family went to Jesus and said, hey, can you raise him from the dead? And so Jesus went back and raised up Lazarus. Now, what they don't say is that he then did die at some point for eternity. But from the time Jesus raised him from the dead till the time that he died for eternity was a gift. And we got this gift with our son, the gift of harm reduction, the gift of recovery for many years, because we changed the way we walked through this with him. And we got Lazarus time. So that's what I have for today. I'm honored to be able to speak. I think, just changing the way that we help families walk through this changes outcomes. So thank you so much for being here and for being willing to help others in the work that you do. So.